Hello, my name is Sean Galvin, and today I will be presenting on tonsillitis and seasonal atopic rhinitis. So to start off with tonsillitis, we need to define the tonsils. The tonsils are two round, fleshy masses in the back of your throat that are a part of the immune system. And tonsillitis is the acute inflammation and bacterial infection of the tonsillitis epithelium. The tonsillitis, or the tonsil epithelium, is the layer of cells that covers the surface of the tonsils. These cells form deep caverns that reach into the lymphoid tissue. Signs and symptoms of tonsillitis are sore throat, fever, difficulty swallowing, fatigue, and difficulty breathing. Tonsils will often appear red and swollen or have white or yellow patches on the tonsils. In the most severe cases of tonsillitis, surgery may be required and removal of the tonsils. So, the cause of tonsillitis. Most cases of tonsillitis are caused by common viruses, but bacterial infections can also be the cause. The most common bacteria that causes tonsillitis is Streptococcus pyogenes. This is also the cause of strep throat. Only the line of strep bacteria are able to cause tonsillitis. Tonsils are the first line of defense from bacteria and viruses in the mouth, which leaves them vulnerable to infection. Some risk factors associated with tonsillitis are young age. This is because the tonsils are most active before puberty, which leads to higher rates in ages 5 to 15. Another risk factor is if you are frequently exposed to germs. This could include school kids or if you are involved in sports with close contact, for example, wrestling. So, how does tonsillitis affect sport performance? Well, in a study, it was found that infections that cause fevers, such as tonsillitis, decrease aerobic exercise capacity by a whole 25%. It was also found that early on into infection, muscle strength was seen to decrease by 30%. If surgery is required, it is recommended that the individual should avoid contact sports for 14 days after surgery. So, treatment for tonsillitis. In most cases, tonsillitis will go away in a few days as long as the individual is drinking plenty of fluids and resting appropriately. For bacterial tonsillitis, prescribed antibiotics are usually able to eliminate the infection in about 10 days. Staying home is recommended until the fever subsides and swallowing is comfortable again. Severe cases of tonsillitis may require removal of tonsils through surgery. Some of the reasons for this removal is the tonsils are too big that they block the throat, which can lead to difficulty breathing and swallowing. Another reason for removal would be chronic tonsillitis, so that the issue is not so chronic anymore. So, prevention for tonsillitis. Washing hands after bathroom and eating is a good start to preventing tonsillitis. Avoid sharing drinks from water bottles or glasses, and also staying home when sick. Another thing to do is covering the mouth when coughing or sneezing to prevent the spread to other people. And here we move on to seasonal atopic rhinitis, also known as seasonal allergies, also known as hay fever. So, what is seasonal allergies? It is the reaction to pollen or airborne fungal spores that causes an allergic reaction. Allergic antibodies release histamines, which causes the symptoms that are associated. Typically, this occurs during spring or fall when trees and grasses release pollen into the air. Some signs and symptoms for seasonal allergies are itchy eyes, throat, nose, and mouth, watery and swollen eyes, headache, and swollen mucous membranes, along as wheezing, cough, and sneezing. So, what are the causes for seasonal allergies? Seasonal pollen production from trees, grasses, and weeds cause an allergic reaction to those sensitive to it. Typically occurs during spring or fall. These allergens cause an increased production of histamines, which creates the reaction. Some might have reaction for a couple of days, while others might have a chronic problem happening year to year to year. So, how does this affect sport performance? Well, it is seen that seasonal allergies result in difficulty sleeping, which could cause an increase in tiredness, which also affects athletic performance. Studies have found that individuals who experience allergic reactions have decreased reaction time, attention, and vigilance when exposed to pollen. Further effects are increased fatigue, depression, and anxiety, which can hinder performance. Some treatments that are available for seasonal allergies are oral antihistamines that can prevent or reduce symptoms, nasal sprays to open sinuses. It is seen that those with chronic allergies may not get complete relief from these symptoms if using these treatments. In these cases, immunotherapy may be appropriate. Immunotherapy is a long-term treatment that may help prevent and reduce symptoms. So, how do we prevent seasonal allergies? Well, to start off, it is pretty hard for those who participate in outdoor sports to completely avoid these seasonal allergies. Although it is important to have proper awareness of temperature and conditions at competition locations. Planning ahead is important as to give any treatments before in preparation for the competition. Another thing we could do is avoid touching eyes and nose to reduce the spread of pollen to these areas. Washing bedding regularly to reduce the residue that's on them, and also keeping windows in the house and car closed as to reduce exposure. And we're excited. And the 10-question quiz is on a separate document.